Yeah, some patients have pain only in the back of their hip. So when that's the case, it's not in the center of the back, it's not in the buttocks or the legs, and separate from your spine is your pelvis. This is the sacrum and the ilium, so this is the sacroiliac or SI joint. When this is the source of pain, there's been some slow degeneration, which happens over years or decades, and then at the time the pain started, often people have done something that starts an episode of inflammation. We hear stories like riding on bumpy golf carts or heavy equipment, sometimes jumping off a dock. Things that kind of jar the skeleton can do that. Or if people have a lumbar fusion, all of these joints usually move collectively some. So if they have a fusion and these joints aren't moving, then the SI joints is the next joint down. They kind of overcompensate and typically can develop pain from that source as well. Or if people have a change in their gait, the way they walk from a foot injury or a knee injury, then the changes in their gait can change the body mechanics and put stresses here. So there's also a nerve adjacent to that. So that location of pain can either be the SI joint or sometimes can be a neurologic source. And we have ways to figure that out with the modifying factors of what makes things better or worse. There's provocative testing on exam where we can try to stress the joint, and there's testing. So when we're treating the SI joint as the source of the pain, we do injections under X-ray guidance where we can be very specific about the placement of the steroids directly to where the problem is. With the joints, they're synovial joints and they're contained within this fibrous capsule. So usually just a single treatment is sufficient to resolve all of the inflammation. Whatever portion of the pain that is from the inflammation, we can resolve completely with the treatments. And if there is any residual pain, it's from the structure. And then people would never get worse again for years or for life unless they get a new episode of inflammation and people begin to be dramatically better, even completely better. And it may never happen again. And there's specific prevention strategies to maintain their healing.